Dear friends, good evening and welcome to one and all to the Namma Bengaluru Foundation webinar in the series called Bengaluru Fights Corona. So we have been going through the first, the second, and the third wave, which is the Omicron wave. Though this is not fatal, but of course, I think everybody got a flu. And that is why we have Dr. K. Satish from Manipal Hospital, Millers Road, with us today, and an expert in pulmonology to share his views and also the discussion towards how we can protect ourselves post-COVID and what are the treatment that we need to do. A brief introduction of the doctor, which I'd like to make, and also I'd like to tell a few words about Namma Bengaluru Foundation. And Namma Bengaluru Foundation is a not-profit organization, was founded in 2009, and we have been working in the engagement of social engagement and also to work on the benefit and also how to improve the city and the citizen's life. So the three main pillars of Namma Bengaluru Foundation, what we try to do in in Bengaluru is civic, health, and environment. So I'd like to introduce Dr. Satish now. Good evening, Doctor.
Hi, good evening. Good
Namaste
evening.
And welcome to Namma
Thank you.
Bengaluru Foundation Bengaluru Fights Corona web series. We have been doing this right after the second wave, and we've been continuing, and we have had a lot of experts and joining us, and especially our citizens of Bangalore who are really interested in knowing about COVID and also about how to come back and lead their normal life. So a brief introduction of Dr. K. Satish is Dr. K. Satish is a consultant pulmonology at Manipal Hospital, Millers Road, Bengaluru. He did his MBBS from JJM Medical College, Davangere, securing first class. Further, he did his MD from Bangalore Medical College with distinction and a gold medal, and went on to obtain DNB exam and MRCP from Royal College of Physicians, London in 2005. His special interest lies in chest disease and HIV. Dr. Satish was selected by the British Thoracic Society, UK, as its inaugural fellow to train in chest diseases at Southampton. He is also the president of the Indian Academy of Allergy and the board of director of HIV Medical Association of India. Dr. Satish is very active in research on the latest developments in science and also participated in public awareness programs, both in print and as well as in the television media. So without further ado, I'd like to welcome Dr. Satish to share his views. And I'll also like to tell our participants today to the flow of the event. First, Dr. Satish will share his views on the post-COVID sequelae, as we call it today. And you can also raise your hands and also type your questions in the chat box. Soon after Dr. Satish speaks to us, we will have a Q&A session in which you can ask your questions regarding post-COVID and how we can all be safe and fine. Welcome, Doctor.
Okay. So thank you so much for the organizers and especially in Namma Bengaluru. And we know that I see already a lot of familiar faces here. I've been practicing for the last 38 years or so and in Bangalore for many, many years. And so I'm very familiar with many of you faces, and I'm so glad that you gave me an opportunity through our hospital as well as through your organization. Happy to share with you, as you said, a lot of things, myths and various non-medical issues associated with the COVID post-sequelae, especially after the second wave. Of course, we knew from the beginning in the first wave itself that this is not like the H1N1 that we saw in 2009. Way back in 2009, the first patient of H1N1 diagnosed and died, unfortunately, was my patient whom I was looking after then. And there were a lot of those time itself that it is highly infectious. You have to quarantine, isolate, and I was that time quarantined and isolated for a few days. Even though nobody understood what is isolation, what is quarantine that time, we stayed at home, didn't go to the hospital for a few days, and everyone received oseltamivir. So there was a lot of things which happened, and then ultimately the H1N1 became an endemic disease. We do see even now, but the COVID has taken over everything, all flu diseases. And I'm very familiar with treating flu, recognizing flu and its complication way back from England days, where during the Christmas time, during the winter time, the hospitals are flooded with flu, and especially elderly people. And many of our hospitals used to be flooded, and red alert in the hospital that always it was full. And then, of course, the flu vaccine, everyone knew about it, can prevent, just like the COVID vaccine that we have now, prevent serious infection. And I've been taking flu vaccine since then, about 35 years. So the vaccine is also not very new to me, or something strange to me. So there are a lot of similarities for pulmonologists with various viral infections, also being a HIV physician who have treated lots of patients way back in 1990s. So the virus disease came no surprise, but the surprise was that it was new, it was novel, and nobody knew how this is going to how this is going to spread. And also when the WHO announced that it is a pandemic, and it was very strange that I was planning to go to China, and during the part of 2020 when this started, and as not for any work or anything, not for sightseeing, to play golf, and all our friends, we started planning. And then suddenly I saw in WION news, there were 3 patients, 6 patients, 7 patients, 10 patients with some very rare form of flu and fever. Nobody knew. And all my friends said, no, you are there. No, come, let's go. Don't worry about it. So we were supposed to go to Kunming. That's my history. And then ultimately the WHO, when announced that it's a pandemic, then all of us withdrew, and we stayed back. And it so happened by coincidence that the first patient of COVID in Bangalore was our hospital, the old Vikram Hospital, which is now the Manipal Miller's Hospital, very first patient. And fortunately, the family and the children were kind enough to, tell everyone. That time was a stigma to tell about the COVID itself, that I've been affected or I've been infected by COVID was a stigma. But they came out and said, oh, this happened. So fortunately, that day, somehow, this patient came with fever, and we isolated somehow in the room, not knowing about COVID at all. But fever and some travel history. The first test came, and it was a surprise that patient had COVID. And we all started working on what is COVID and how to protect others, how to protect people who are doing all kinds of work in the hospital. As you know, there are several kinds of departments which get involved when single patient get admitted. So that is the history now. It looks like ages now, when the first patient started, and then slowly we started seeing patients all over India, all over the world. And then I made an effort to learn quite a lot about it. And the initial period of, like what we said, the lockdown, how it helped the hospital to get up with equipment, knowledge, training, PPE equipment, masks, and so on, because it was all new, and how to prevent infection in the hospital to other patients as well. And we did a lot of background studies from Wuhan virus, from Wuhan lab. And then, of course, when it spread all over the world, and then we moved on to hear webinar, others' experiences, and then learned so much about it. Of course, when it became common problem in India, and we all started, seeing more and more patients. That's the, history we know about how we all went about it. And then the second wave was terrible. And it affected a lot of young people and old alike. And then we had a very difficult time to get the hospital beds, the oxygen beds, And then I was in the COVID expert committee from day one, and then managing COVID, and also protocols from the BBMP and expert committee, and also analyzing death in various parts of Karnataka. I was part of the mortality committee. So we were taking out the case sheets from Raichur, Gulbarga, everywhere, Bangalore, and studying them and what symptoms they had and why the death occurred, what could have prevented, what medications, everything was new, completely new. It was a great experience, I must say, to learn about this COVID. And we put in a lot of effort to form the protocols. And there were, of course, as you know, there were very vague, unscientific treatment, which was extrapolated because it was new. Nobody knew anything about it, except that it's highly infectious and spreads. And we were asking very in detail about the history of patient. Did you travel? Did you go to Europe? Did you go to Wuhan? Did you go to China? And so on and so forth. And ultimately now we don't even ask because there's a community spread. Nothing, such is required. So that is the, kind of evolution that, this virus, had, and we all learned so much about it. And there were many drugs which were in pipeline, extrapolated again. There was nothing new that we had for this virus. But what was a turning point was when the virus genome, within few weeks to months, was laid bare. We knew the structure of the genome of the virus. And the NIH came out and saying, we can do some research and find a vaccine. So look at the way the science progressed so fast. And within few weeks, there was a genome, the viral genome splayed across, and fortunately, it was shared. And then NIH scientists started working on the vaccine, and look at the number of vaccines that we have. And look at the way the vaccine prevented serious illness and serious disease. The third wave, everyone thought will be a big than the second wave in terms of infection, in terms of mortality. But what has happened, as you all saw, that fortunately also the Omicron variant, which is there in the community now, all over the world, 98% of India's strain now is Omicron, which behaves just like a flu, highly infective, an R naught of something like 10, which means one person will infect 10 people. So lots of patients got infected and got also not very sick in terms of being hospitalized, but got sick. And they took time to recover, especially elderly people and middle-aged and also young people. Many children were infected with Omicron. And many I see in my clinic coming first time, and they have not been tested because they didn't know about it. I don't blame them at all. They say, I have this cough which is going on for 2-3 weeks. Did you have fever? Only 1 day fever. I had only 1 day fever. After that, I was fine. But the cough persisted. They're all Omicron. They're nothing but Omicron. It infected everyone. I don't think there's anyone who's spared in general, which is in one way hindsight saying that it caused a lot of herd immunity. So if you see the serosurveillance rate, the children, something like 80%, 90% are infected by everyone in the house and going to school, and their parents, grandparents, also they got infected in turn. So when people tell me that, I was fine, I got infected from a driver, I always come out and say, don't tell me this, that you got many drivers are infected by their owners. Don't now tell about who got infected from whom. It's not important. But the Omicron gave a kind of immunity to everyone, even though the peak was in the last month. Something like Bangalore saw 25, 30, 35,000 of official positive ones. I'm not talking about unofficial, which I'm seeing in the clinic. And when you see the serosurveillance, everyone will be infected. And they also got nicely immune to the virus. So now we are definitely seeing about yesterday's statistics, something like 700 in Bangalore, so we are sitting, fine. So there were a lot of stigma, as I said, in the beginning, and mainly because the BBMP came and put a lot of board and then obstacles and things like that, and which caused a problem. So I was one of them responsible. Please remove this, not required. So people will come out and test and remove the stigma. And nowhere in the world people are doing, don't block the apartments and things like that. So it was a learning curve. I'm not blaming anyone. It was a learning curve for everyone. And then fortunately that was removed. And so that led to everyone coming out and saying, yes, we got infected, so we got better, or we got hospitalized and things like that. And the therapies also change, evolve. And we have now very clear evidence what works and what does not work. So there are only 5 drugs which are there, which work, and the others are all removed from our textbook or dictionary or from our treatment charts. The remdesivir, the steroid, the tocilizumab, baricitinib, and there's no role for like plasma and things like that which we use. And there are some new antivirals which are in the pipeline which have been also used, and of course the monoclonal antibody. So as the awareness increased and public also got involved, which is fantastic. They were questioning us, asking us, this will work, this will not work. Why steroids? Why high dose steroids? And things like that, happened. Now, what is important for all of us to know is that the COVID, unlike other diseases, like, for example, tuberculosis or the flu that we all saw, or the malaria, the typhoid, the infectious disease that we all saw, once you recover, you recover. After a few days, you are fine, you get back to work, and then you forget about the infection that you had, whether it is malaria, typhoid, pneumonia, urinary infection, whatever it is. It does not leave behind the sequelae of the infection. So what is unique about the COVID is it leaves behind the post-COVID sequelae. Even now we see patients from the first wave, from the second wave. And if you see the world statistics, 26% of patients, something like 26-27% of patients, even after 6 months to 1 year, still have some residual post-COVID complaints. And either it is fatigue or breathlessness or cough or brain fog or pains and aches and fatigue and being not normal, insomnia, mood changes. So all this occurred in many patients during that first wave. The more severe the disease, the more time you spend in the hospital, in the ICU, the more severe and longer is the post-COVID consequence. Especially everyone was aware of the lung consequence, the pulmonological involvement, or the involvement of the lung and chest. And many patients still fear. During Omicron, I haven't done even one patient with CT scan or a blood test or anything. It's treated like a flu. Not even one patient, required, except those who were hospitalized. But during the second wave, everyone got the scan done on their own and with the help of either doctors or patient relatives or the neighbors. Everyone was treating COVID that time. Do this CT scan, do a D-dimer test, do a CRP test, and everyone knew about it. So the consequences of pulmonary, what we call post-COVID sequelae, made people think that every patient should be worried about the complications of lung in form of requiring oxygen, a non-invasive ventilator, and rehabilitation. Those were some of the things that were required. So what I'm going to say is, I thought I'll use my slides, but they're all scientific. Let me speak like this. I think it's better to connect with all of you. And because we rarely do that. Nowadays, we always use slides. It becomes very easy. Way back in 90, there were no slides. So we just spoke, extempore, and then spoke to people. So The pulmonology consequences are the consequences of the lung, which were very severe. Patient developed. I won't call it as fibrosis, mainly because fibrosis is a permanent and progressive disease and an irreversible disease. So in this, there is no, fortunately, I still see patients today. Also, I saw a couple of them from the second wave, even after 6-8 months, having some consequences of that or sequelae, but they never, is progressive and permanent. There's no permanent damage to the lung from even the Delta and Delta plus variant. And patients did not, they suffered in the beginning, they required oxygen, many of them still on oxygen, but with time, the lung healed by itself with support, with exercise, with pulmonary rehab, and also with physiotherapy and so on. So they healed by itself. So I was always saying that patients, don't worry about, you may require a non-invasive ventilation, CPAP or a BiPAP, but ultimately you will be fine. You will be all right, and you will recover because the nature heals. And there are just about few percent, maybe less than 7%, 5% patients who required some treatment for progressive lung disease or lung fibrosis, what we call. Lung fibrosis is permanent. So most of them can have static lung function, which means they get back to a certain level of activity, but after that, they are fine. And the initial days are the ones which are bad for all these patients. They may have nose block, they may have throat problem. Especially now, I'm seeing lots of patients with throat issues in the Omicron phase, and many of them have persistent cough. The cough is one of the predominant feature in patients with post-COVID. And a persistent cough, a cough would never respond to any treatment. That is one of the unique feature of the post-COVID bronchiolitis or affecting the lungs. There is inflammation. The virus is gone, as you know, by the 10th day, whether it is a Omicron virus or the Delta variant is gone. It's all the dead virus, and the body's immune system does not recognize whether it's a live virus or a dead virus, and it pounces on these dead viruses, causing severe inflammation. So inflammation is not infection, so it's an inflammation. Inflammation is swelling, twitching, irritability, and kind of irritation that occurs in the airways, whether it is in the nose, whether it is in the throat, whether it is in the bronchi or in the lung parenchyma. So that many a time leads to all the pulmonary consequences of COVID. So fortunately, in Omicron, this is not so. So Omicron affects the upper airways and then the bronchi and doesn't affect the lungs. So they never drop their oxygen, except very rarely patients with very severe comorbidity and elderly people drop their oxygen and they need to be hospitalized and given treatment. Most of the vaccinated people are never very sick. They are, some of them elderly with comorbidities, even with Omicron Delta variant, got admitted to the hospital, but they got discharged within 5 days or after 5 days. Very few went on to the ventilator. We have just few patients who are on ventilator or tracheostomy, and not like the COVID second wave when Delta was raging all over the world and especially in India. And many patients were on ventilators. So there were a lot of ventilators which were imported, and there were a lot of ventilators which the government purchased. They're all lying idle now. And they can be used, of course, in the future, not just for COVID, but other things as well. And what happened with the COVID is also the infrastructure in the periphery, in district hospital. They've never heard of, in the sense, how to manage a patient on ventilator, how to manage a patient on dialysis. Now, all district hospital where we did many of my colleagues did e-consultation. We were also consulting them, they were consulting us for help So they learned about the ventilator, they learned about the central vein, antibiotics, and dialysis, and so on and so forth. So sorry. So the infrastructure also around this, improved. So as I said, the Omicron fortunately is not causing a great deal of pressure on the healthcare requiring oxygen. You saw during the second wave that many patients who could not find oxygen bed, who could not find ambulances, the ambulance were failed. All kinds of things happened. I think you just have to forget about what happened. It's very traumatic for anyone for what happened during that time. But now, during this wave, we have done very well thanks to vaccination, thanks to every citizen who came forward, every doctor who said, look, we have taken vaccine. First thing was that we all took vaccine. As doctors and scientists, we said we are the ones who will be guinea pig. If you are worried about it, we will take the vaccine first. All of us, our nurses, our paramedical staff, all of us took vaccine, and there was nothing at all. There was a lot of rumors and all kinds of things happened. But we are the ones who showed that the vaccine, please take the vaccine. We are the front care or the frontline workers. And that led to vaccine drive. And thanks to the Indian government and every state which vaccinated most of the people who could not afford. I think if you see any drive, healthcare drive in the world which has happened, including from the Spanish pandemic, I think this is one of the things that we should, we should say, thanks to the government and other persons who were involved in vaccinating, going to the villages, going to the states and vaccinating. So we are sitting pretty well with vaccinated population on one hand, and then those who were infected on the other. Everyone, most of the Indians got infected in some way or the other, and that led to our third wave being not so bad, and we were able to manage and carry on without lockdown. There were restrictions, that's fine, but also the citizens came out and said, okay, we'll not go out, we'll not attend functions unnecessarily, we will wear masks. There were some issues that I won't say that anybody would be locked down for 2 years will have difficulty wearing a mask. It's become part and parcel of us, of course. Now, without a mask, we just can't go as doctors. We have never seen our faces, our colleagues' faces properly without a mask. All of us wear masks. And that in one way, we know that also helped us. Like, for example, especially pulmonology, if we don't get infected frequently now with infections in the hospital, which we used to get earlier, and also the tuberculosis. I'm being a TB specialist. I'm seeing less and less number of patients infected. And the lockdown helped, or restrictions helped in reducing the pollution. And we hardly saw patients with acute asthma, acute exacerbation of COPD, acute exacerbation of ILD coming to the hospital because of this. These were all prevented. And I was talking to someone today in the hospital and saying that now onwards, whether COVID or not, all our respiratory patients who are on oxygen, who have a very severely damaged lung, and I will recommend, or our society will recommend, the Indian Chest Society will recommend, or the Karnataka Pulmonology Association will recommend, where I am the president of the association, recommend to use the mask wherever you go, whether COVID is gone or not, because it will help you to prevent infection, number one, and prevent also pollution-related exacerbation. So in that way, we have done quite a lot. Now, the other consequences or other sequelae of the lungs, apart from the lung, which I mentioned, and many patients are doing well now and recovering well, and the Omicron, of course, didn't cause much, is the heart issue. The heart also got infected during that time, causing what is known as myocarditis, fluid. Heart attacks were common during the Delta wave, mainly because this virus not only caused inflammation, but also caused what is known as thrombosis, which is clotting. So patients clotted and blocked their arteries, whether in the heart or whether in the brain, or elsewhere. So that led to strokes, that led to heart attacks, which were very common, and of course the lung causing pulmonary embolism. So that, of course, we treated with anticoagulants and blood thinners and so on. And that helped patients to recover faster when we identified them. And then we put them on generally on blood thinners, and they go home and with blood thinner, and to prevent further consequences. That's about the heart. And about the other things are like brain. I said about the stroke, which were also common, and which were causing stroke in patients, and also brain fog, which is also a post-COVID sequelae. Brain fog is like unable to concentrate, remember, clearly about this. This was like a post-traumatic stress disorder, PTSD, where there is inability of an individual to concentrate or memorize or remember things, and also had a lot of stress kind of a thing. That was very common during the first wave and second wave post-traumatic stress disorder. And many of them had insomnia and fatigue and unable to concentrate and things like that, which fortunately there were few medications for anxiety and depression, which also were due to post-COVID, like mood changes, well known. And these were some of the central nervous system brain changes which occurred in these patients. And slowly it got better on its own with some of the medication which helped during that time. So that was the involvement of the brain. And regarding the muscles, musculoskeletal disorders and things like that, the pains and aches were very common. Patients had a lot of body ache, pains. Joint pain was also common. Patients developed a lot of these pains and aches, which responded, some of them, to simple analgesic anti-inflammatory medication, physiotherapy, and so on. The muscle pains were very severe, and fatigue and breathlessness for no obvious reason. Like, for example, their oxygen used to be normal, their scans were normal, X-rays were normal, pulmonary functions were normal, but still felt breathless. So many of them were unidentified. Many of them have no solution. Many of them, there's no scientific background for all this. Of course, the research is still on to identify various chemical mediators of inflammation. These are all due to inflammation which occurs in the body due to the virus, and leaving behind all this. So that also came down in the second wave because many were partially vaccinated, and vaccination helps to preventing post-COVID sequelae. There can be a post-COVID syndrome or post-COVID consequences, but it will not be very severe, was not observed very severe in vaccinated population when compared to partially vaccinated or unvaccinated population. So those were rheumatological manifestations. There was skin manifestation. In the last 2-3 days, I've had patients complaining about rashes, and there are about 10-12 types of skin manifestation one can get. And I'm not talking about the skin disorders getting aggravated, like psoriasis, for example, or pre-existing skin disorders. But skin disorders are very new to the coronavirus infected patients after recovery. Rashes, erythema, nodular lesions, scaling, dryness of the skin, and so on and so forth. So those were also described. I don't think there was any single organ which was spared. Maybe if I remember, maybe bones were not infected, but there were aches and pains, which means the joints were also involved. The eyes were also infected. There are eye changes which are beautifully described here: choroiditis, scleritis, blurred vision. Those were also described as a consequence. Recently, I had a patient who was to travel to Australia, developed a blurred vision and some inflammation in the eye due to COVID, and which generally clears with time, but everyone is worried about the consequences of that. and the stomach, intestine, liver disorders, and anorexia, unable to eat, and weight loss. Especially in the second wave, we saw a lot of patients losing weight. Even those who were monitored at home, who didn't go have to go to the hospital, and they lost a lot of weight. I've had patients who were saying, "Oh, in 15 days, I lost about 8 kilos, 6 kilos, 10 kilos, and all that." So I was joking with them, anyway, you're not doing exercise, you have put on so much weight, at least you have lost some weight. But many of them became skin and bone with a very severe infection. It was similar to cachexia, patients who had tuberculosis. And of course, ultimately, they put on weight, and then they recover. So weight loss was another post-COVID sequelae. And the others were intestines were affected, and there was every organ in the body was being infected by this. And the treatment generally consisted of giving them a symptomatic relief. For example, pains and aches, paracetamol was used. For breathlessness, inhalers were used. And severe breathlessness, dropping oxygen, who required oxygen, courses of steroids were given, and pulmonary rehabilitation was done. For heart attacks, of course, angioplasty was done. Patients underwent the angiogram, and blood thinners were given, aspirin was given, those kinds of things, and were given. Also, the other important thing is that India is what I should say is room for diabetes. So India has lots of patients for diabetes rather. So the diabetes control went hayway without the steroid. I'm not talking about the steroid. Without the steroid, their diabetes went up. Even now with Omicron, I'm seeing patients doing, I had no problem with my diabetes. Suddenly my sugar is 300, 400. So that's all temporary. They require temporary adjustment of the dosage of medication, but they bounce back and the sugar come down. Of course, during the second wave, we had to use steroids, and we used steroids when required in proper dosage. That also caused them to have elevated sugar levels, and patients got better once the steroids were stopped. So these were some of the common problems that we faced. These were some of the problems that still patients have, and many of them are not able to recognize. Many physicians and others, everyone, oh, you had COVID, so it's fine. So they require a lot of counseling. They require a lot of psychological counseling. They require a lot of reassurance, because I feel that post-COVID sequelae is one of the most ignored and neglected disease that I'm seeing now. Everyone is worried about the acute COVID, in the sense they are hospitalized or given treatment, they take oxygen and they get better, they go home, they forget about it. But that's not so, because that's not the end of the story. They require a lot of counseling. They require tests to find out about various deficiency. For example, found a lot of vitamin D deficiency. And that's because not exposed, not going out in the sun, being locked down and so on. They had a lot of problems with vitamin D level. And then also we saw patients with B12 deficiency, other deficiencies among patients. So there was a plethora of syndrome and signs and symptoms that patients developed, and a lot of psychological counseling that was required, especially for insomnia and those kind of things. And we still see patients coming to us saying that they still not recovered fully. So it is a very complex syndrome, post-COVID syndrome. A lot of research going on all over the world. And some of the medications which were available during the later part of the second wave, like monoclonal antibody, and treating early, reducing the viral burden, reducing inflammation in the body, reduce the post-COVID sequelae and consequences. So these are, some of the things that came to my mind from my experience. Instead of using the slides from borrowed slides, I thought I'll tell you about these things that I still see patients still require a lot of time and counseling that is required, and they deserve it. They deserve all this. You just can't brush aside and don't worry, it will go away. It will never go away. And by doing that, so it requires a constant kind of vigilance, and some of them can be very serious, so one has to be careful. I think that's all I have for all of you. And if I missed out something, maybe something creates are the common ones I've addressed. And if there are questions, I'm ready to take any questions that you have. And if my experience has given me knowledge to address those questions, I'll be very happy to address that. And if I can't address that, I will just look up and then share with you on your email or WhatsApp, and then tell you about what is all this about. Thank you. And thank you for giving me an opportunity. Nama Bengaluru and also my team, Manipal Miller's Road, have done quite a tremendous job in fighting COVID and also vaccinating people during this pandemic, and lots of things that we have done at the hospital during the COVID times, operating on patients, doing surgeries on patients, and so on and so forth. Thank you once again.
Yeah. Thank you, doctor. Thank you very much. I think that was a beautiful session, and especially with your practical experience and also being a pulmonologist. I think in no better words I can say that you have really been hands-on on this first and second wave and also Omicron. And I think it was a very informative and insightful session. I'll go directly to some of the questions that have been being raised here. Also, we will unmute few people. And I think there were some questions in the chat box. I think we can unmute Pragya Prasoon. Usha, can we unmute Pragya Prasoon so she can ask the question directly? Yeah.
Yes, Pragya, you can ask your question.
Good evening, Doctor. It was indeed a very good session. Thank you so much for sharing all those information. I wanted to know a couple of things, especially during this third wave. Why this 7 days of quarantine? And do you think is it enough for people to not infect any other person? Because we have seen in our community, we have seen people getting infected and then coming out of quarantine after a week, and then the other member of the family again getting infected after a week, once they have recovered. And what do you think the reason could be in this kind of situation? Because the second time infected people were either their parents or their children, so who were not going out. So what do you think could be the reason? This
excellent. I can definitely see Pragya. Excellent question. See, initially we said 14 days. There were others who did 21 days or many of them I know. Why are you saying? I don't know. I thought I won't infect anyone. 25 days, 30 days people have done. Ultimately, when we studied this virus and the cultures were done, so we were not able to culture, the scientists were not able to culture them, which means there were no live virus at the end of 14 days. So initially it was 14 days. And as we understood more and more about it, and there was a vaccination program and vaccinated population, most of it, then we found that patients after the 10th day, so after the 10th day, there was hardly anyone who had a live virus which were culturable. The test can be positive. That's why we stopped doing the test. I've never done any test for anyone after they got better because there was no need. Because if you do the test, it will be positive, and that's the dead virus. If you put it for culture in the lab, you won't grow. But we won't culture them only for scientific reason. We do it in research because it requires a particular type of lab, which requires all kinds of precautions which can explode and spread in the lab. Number one. Number two, also very expensive. So with all the data in mind, so we learned that 10 days was enough. And then we boiled down to the 7th day, mainly because also during this time, many were vaccinated. And we found that by the fifth day, seventh day, the viruses were also coming down, and then the dead viruses were still seen on the eighth day. So what we said, or the scientists said in the guidelines, is that from the seventh day, which means eighth day onwards, move around, no problem, because a lot of work to be done, and already the world has suffered. And you wear N95 mask, see that everyone around you wear a mask. We all went back to work on this eighth day because we were required to do the work. And many of my colleagues who had infection, they worked in the COVID ward because there's absolutely no problem working in the COVID ward. Many of them stayed in the hospital, I know about it. And then they said, we will look after the COVID patient because they were not so sick. So that's the beauty of the science, that, evolving science. And CDC has done 5 days now in America, saying that you go back to work after the fifth day, sixth day, not seventh day, and wear the mask during that next few days, like 10 days. That's what I've been saying, everyone. So 10th day onwards, you are as good as being non-infective. And from the 7th day, you can come out of the room, even you can go to the work, your factory, wherever, but wear N95 proper mask. And that's about the isolation. Coming also to your question about others being infected after a few days. So what happens is there is a lag period. So a person starts infecting or being infective before he develops. 2 days before I develop fever or any symptom of COVID, I'm infective already. So I spread infection already in the community because unknowingly, because I don't have any symptoms, Pragya. So I go around everywhere and then be like a normal person, I infect. And then by the time I know about it, I'm already highly infective, of course, that time. So this spread, and at home, also we initially, many patients said we are 80-year-old, 90-year-old, we don't go out of the house. So we don't require vaccination. I don't have vaccine. I don't have COVID. But the other younger people at home are going around. They have to go and earn. They have to go to the school. Children have to go to the school, and so on and so forth. And they got the infection back home. So in that way, everyone got infected. The old people got infected by not going out, by the family members and others. By just going for a walk, nobody gets infected. And by stopping during the walking and having a chat with someone who carries a virus and who do not have symptoms, can infect. Just to answer your question. It's an important question. Yeah. Yes, Vinod.
Yeah, thank you, Doctor. I think in the interest of time, there's a couple of questions in the chat box which I'll ask. Doctor, I think Mr. Gopalakrishnan KV has asked, I had a mild infection on 28th and recovered fully. I play shuttle every morning. I want to know when can I resume the playing, and as well as he has taken all the doses, first, second, and the booster dose also. So he's saying when he can get into his normal activity and also play the sport. Yeah. He's 62 years old. Doctor.
50, 52.
62.
Okay. So very important and pertinent question, especially in the Delta, where we used to say, start doing exercise gradually and then see how you respond to your exercise tolerance and so on. So check your oxygen level, check your heart rate, and then gradually don't do strenuous exercise, don't do weightlifting, don't do treadmill, and gradually you go on increasing depending on the body's response. See how your body is responding, and then you will know by yourself, how you're doing. So that's what we used to do. But we also learned, again, the science of, for example, sportsmen. The footballers who are testing positive come back after a few games. And then the tennis players, the cricketers who were isolated, they all come back. So I've had very close dialogues with the Indian cricket team and others, and how they go about it. And now, so immediately one can start doing exercises because one is vaccinated. And if you didn't have hospitalization kind of a situation, and your oxygen was not dropping, you stayed at home. So start doing at home itself from the day 1, day 2, when you feel good, simple exercises, muscle relaxing exercises, joint relaxing exercises, breathing exercises and start getting prepared. And then when everything is over, then you start going out and do whatever required. So to come back to your question, you can start playing the shuttle. You see the response on the first day, but start always by warming up nicely.
Yeah.
Don't just go and play. Warm up nicely, and then see whether you're okay with that. Start playing few games, not a very aggressive game, and then see the response to it. And first 1 or 2 days you may have problem, but after that you can go back to your usual. That's what we say. Young people, of course, the professional sportsmen, they can immediately go back, provided their body is fine and they are tuned to do it. Young people, the footballers, the cricketers, and they all go back, quickly.
Yes.
Others should take some time and do gradually exercises.
Yeah. There's another question from Vivek. He says, my mother, Madhu Agarwal, has wheezing problems since 2008 and is an old patient of doctor. Many thanks to Dr. Satish, sir, for the consideration. So it's actually a very good thing for you and compliment for you, doctor. Thank you. I think there's a hand raised and...
Thank you.
Yeah, can we unmute Anuradha Nittur, please?
Yes.
Miss Anuradha?
Yeah. Yes.
She can ask the question.
Madhu Agarwal is my very old patient. I'm glad she's not in Bangalore.
Yeah.
And she must be watching from somewhere. And way back she used to have problem. Now she's in JP Nagar and doing very well. And on and off she gets severe attacks of this problem. But she's very brave and very courageous, and she's very good. She's been hospitalized, sometime, but very good family.
Okay. Yeah. Can Ms. Anuradha, you can go ahead with the question, please, to the doctor.
I have two questions. The first one is Omicron airborne? And the second one is, if it is a mild variant, why are deaths occurring? Is it due to comorbidities, or is it something that we are missing out?
I think we lost doctor.
He has to log in again, I guess.
Yes, we'll wait for him. Meanwhile, request to everybody, please do leave your email IDs as well as your numbers in the chat box, and also follow us on our Bengaluru Foundation on all social media. And also, you can actually consult with doctor. He's at the Millers Road, Vikram Hospital, which is Manipal Hospital now. Namita is also here. She can type the contact details of doctor, at least his email details, so that we can give, if Namita is here. Hi, Namita. Yeah, doctor's back.
Yeah. Okay.
Hi, doctor.
So
Sorry,
quickly to this question about Omicron. So some patients who are not vaccinated have had Omicron causing havoc in them, very severe disease, just like the Delta that we had. And number two, those who are elderly and who have multiple comorbidity, even with Omicron, they came to the hospital and they had low oxygen, just like the Delta, but they've all got better quickly. Very rarely we have had very severe patients with Omicron causing, requiring ventilation and multi-organ failure and so on. So the numbers, as the numbers rose, as I said, 98% is all Omicron. So naturally, like any other flu, there are patients who have lots of problems like any other flu. In fact, many do not know that flu itself is so dangerous in elderly people and those who are not vaccinated, and it can really cause problem in the world.
Thank you, doctor. I think if there are no more questions, is there anybody? I think there was. I think Anuradha, she has another question on this. Yeah, please. You can unmute yourself, Anu.
Right. No, has it become airborne now, the virus?
Yeah, good, very, very good question. So when you say that there is a community spread, it means generally the community spread or the community already is infected means it infects a lot of people simultaneously. As I said, the Omicron is 10. To be very specific, for example, if you walk around for example, in the hospital or anywhere, you will not get, because many are worried about the hospital. If you see a lot of studies which are done in the hospital environment, and the hospital environment is the most safest actually. Many of you may not know. The COVID was all different level, and they are in completely, they are isolated, and we do very good triaging. Simply because why hospital is a good environment, because everybody is wearing a mask. We insist that patients wear mask as they wear outside. We also insist that they come with proper mask, not a cloth mask, double mask, or they come with a surgical mask or a N95 mask and so on. But I'm saying about outside, for example. If is it there, the air as I go, will I catch an infection? No, you will not catch an infection. When I go to a movie, will I catch an infection from the air there? No, you will catch it from somebody who is in close contact. At least the contact must be close for some time. For example, you have gone to a club and then sitting with someone chatting for hours, then you are likely to get. And you have gone to a marriage function or any function, that's why there were restrictions about it. So those functions, then you will catch an infection simply because you are in close contact for a long period of time. So that is about not being in the air as you go to the office, as you go to the gym, or as you go into, for example, walking in the garden and things like that. You won't get infected. It has to be some close contact with people, one person wearing a mask less, two people wearing a mask almost nil, and a proper mask, and properly worn mask.
Yeah. Exactly. Thank you so much. That was really true, because we were working with BBMP on a mask up campaign, and that's what we told everybody: stay away from crowds and always mask up and keep your hands sanitized. I think there's one more. Can we take one more question, Doctor? With your permission,
I'm fine.
Okay, Doctor. I'll ask, Vivek to unmute. Please unmute.
Hi, sir. Sir, it is a very good session. So, sir, we got vaccinated. Yeah, sir. And we got vaccinated 2 doses we have got. But how much are we prone, or my parents are prone to Omicron variant? How can we or this booster dose is sufficient for us for my parents?
Okay, excellent question, Vivek. See, what happens is these vaccines does not protect you from an infection. See, all of us will get infected even though we are vaccinated. The infection will not be serious in vaccinated population. Since you have already been vaccinated, don't worry about the antibody level. People are doing antibody level every month, every few months. It does not matter. As long as you are double vaccinated, you are quite safe, even though the antibodies by nature will come down. But don't worry about it. You can get infection, but you will not become sick or serious. Even if you become, or even if somebody becomes serious, they can recover faster with medications and early identification. So what Vinod was saying is still follow that, masking, sanitization. Just clean your hands with soap and water. You don't require a sanitizer. And then wherever possible, even now, wherever possible, if you can avoid a function or a gathering or a crowd, you should still do for some more time. And then, of course, important is to vaccinate. The booster, of course, is available. Vaccinate. And there are many questions actually people ask for me. I was told not to take a vaccine. I was told wait for some time. There is no disease. There is no category. Of course, leave the children and so on. I'm sorry, I'm saying about it, where one cannot take a vaccine. You have any serious disease, you are the first one who should come forward and say, I want to take vaccine. A cancer patient, chemotherapy patient, those who have HIV and AIDS, those who are on immunosuppression, those who are on anticoagulation, those who have heart disease, those who have kidney failure, those who have heart failure, those who have severe asthma, those who have COPD. The name is endless. So everyone, those who are mentally challenged, those who have epilepsy, neurological disorder, stroke disorder, and old people, everyone should take the vaccine. There is no contraindication for a vaccine. There is only one contraindication, I keep saying, for a vaccine, that is development of a severe allergic reaction to the first dose. I have hardly seen anybody getting fever 1 day, 2 days is not a reaction. It occurs with every vaccine. And that will resolve by itself, but the advantages are huge when you take a vaccine. So that is why, so only one patient I had who reacted severely to the vaccine, an allergic reaction. But there are many who are saying, I am allergic to particular drug, can I take? Yes, you can take. I am allergic to food, shrimp or seafood, can I take? Yes, you can take. And so there is no way that anybody can say that I am on a blood thinner. That's another common. You should be the one who should take first. And it's not going to matter, you're not going to get a severe reaction or anything about it. So vaccination is the way forward to prevent the hospital being flooded with sick people and flooded with lots of serious patients.
Thank you so much, Doctor. I think we have one more question from Dr. Savita. You can unmute yourself. Dr. Savita? Yeah. Please go ahead with the question.
Yeah. Good evening, Mr. Vinod. Actually, on my behalf of my husband had got into this link. He just on and he left me and we went. And good evening, Dr. Satish.
Hi,
Sir, I am Dr. Savita. I am a periodontist, MDS. I just stay few kilometers away from you, right opposite to Spandana Hospital. And very nice to meet you. I've been watching you since my childhood, sir, but I never had opportunity to meet you.
How nice.
I just thought I'll share my experience, sir. First of all, I think we all know I wanted to know what the common man perspective about this, because we also have a lot of questions from the patients.
True.
And there's a lot of myth that dentist, you go to meet a dental for a dental treatment, there are more chances of infection. But then, according to the scientific evidence, we don't have, that cross infection doesn't happen, sir, because we are the ones who are having a lot of disinfection in the clinic going on. And we all are really following all the protocols. So just this myth is there, sir. I don't know how to get out of it. Still, people are scared to come to a dentist.
No, you're 100% right, Dr. Savita. In fact, the dentistry and the dental practice is the one which was most affected, I feel. And very unfortunately, many young doctors had to close their clinic. Hospitals have closed. Establishments have closed, unfortunately, because of this myth. And India has one of the worst dental hygiene in the world. It's very well known that we don't do regular dental checkup, whether it is doctors or anyone. And then there are a lot of infections that we see, which is because of the bad oral hygiene and dental hygiene.
Sir. Yes, sir.
So I feel that the dental hospital or a clinic is one of the safest, I feel, because as you said, you sanitize well, and then you are always wearing a mask. And the doctors are not spreading infection there. And it can never, ever happen that a doctor in the hospital or a dentistry or in the hospital can give to his patient, because he's always wearing a mask. He's always careful. And he's in fact asking patients also to, as they pull down, trying to show their face or explain, we are still saying, please wear your mask. We know it is. And these are tough times, difficult times. And but I don't think one should worry about going to your dentist at all. And it so happened many years back, 30 years back, when I was seeing a lot of HIV patients. Again, same thing was being spread, that the dental place, the dentistry or the dental surgery is the place where the infection can occur. So they are very hygienic, very sterile environment. One should go to the hospital if required. What we said in the expert committee and the experts said during the peak of this Omicron, if it is required, you visit the hospital, because we are already burdened, not because there are infection which will spread in the hospital.
Yes,
the
sir.
doctors
Yes.
are already burdened with lots of patients. That is why take your time and go only if required.
Yeah, we
And
just stopped
otherwise,
the
now
aerosol
of course it's all
procedures,
open.
sir.
Everyone should go and have their regular checkup when required.
Yeah, we just stopped the aerosol procedures, sir, in between.
Yeah.
And just did the non-invasive procedures, so that make them also make comfortable.
Yeah.
But of course, sir, I was been educating all my patients. Oral health is very important. In fact, I gave a talk in DD Chandana also, sir, during
Yeah.
COVID time, pandemic time, how to
Sure.
keep their oral health, during this particular pandemic time, and how they have to take care of this toothbrush, all the small things, I think, which are very important for a common man.
It is.
So, yeah, thank you so much, sir, and I hope to meet you one day.
Yeah.
Thank you.
Thank you, Dr. Savita. Thank you so much. I think we have come to the end of the session. There's a small question.
Vinod, there is one more question from Ms.
Yeah.
Rekha Chari. If you could just finish that, please.
Yeah.
He says our entire family was infected last month with Omicron. I'm still having symptoms of stuffy nose and itchy throat. How do I get over this?
Yeah. So this is one of the common problem that I am seeing today. I think in the hospital, lots of patients with this common complaint. As I said, Omicron affects the upper airways, and generally does not affect the lung, where the oxygen becomes low, or patient develop post-COVID sequelae like fibrosis or scarring in the lung requiring oxygen. So it affects the upper airways, and slowly it will resolve. But as I said, as you also experience, that it's very irritating and disturbs and poor quality of life. So what we do is we don't give any. First of all, I have not given antibiotic to any COVID patient. Not even one patient I have given any antibiotic, unless they had a bacterial infection. So there are a lot of people who are receiving like azithromycin, doxycycline. So that is not the thing. So a decongestant will help, and for throat itching and anti-allergic, any tablet will help, and slowly it will resolve. Yes, it's irritating. Yes, nasal sprays will help. Similar to what we treat as an allergic rhinitis, there is an inflammation left behind by the Omicron, and you require only simple remedies. So during the Omicron, Vinod, I must admit here, I have become a good general practitioner.
Okay.
Forget about being a super specialist, because I only gave very simple medication. Everyone was wondering, and then once they realized, there were a lot of people who were consulting me simply because I was giving only paracetamol. I was telling them gargle your throat, take some cough remedies, and which I reinvented myself, going back to the basics of a general practice. And that's what I gave. Nobody received antibiotic, nobody did blood test, nobody did scan during this phase.
True, doctor. It's like the saying. Yeah, it's like the saying that goes, when you visit a doctor, most of your the diseases, they just fly away, because we meet a doctor and your healing hands, and as well as the thing that you give is really, really good. There's one last question that Lakshmi Fadke has actually said in the chat box. So, does this virus affect hemoglobin levels?
Yeah.
Does this COVID virus?
Yeah, good question. I've had this kind of a patient who had low hemoglobin and who was asking me, will COVID affect the hemoglobin directly? No, it does not affect directly. It can be indirect. Indirect means, for example, vitamin deficiencies, which are well known to occur during the COVID times, because you are not going out, and then also not checked up your B12 levels or iron levels. Or there could be drug induced, because many of the drugs which can cause gastritis and cause some kind of a slow, gradual bleeding inside, and those kind of situations. But directly, anemia is not well known. But those who had COVID, very severe COVID, during the second wave or during the first wave, they developed, because they were sick for weeks together and months, they had what is known as the nutritional, the anemia of any chronic illness, chronic disease, and they developed anemia. and low hemoglobin level. So not directly it will cause, like platelets, for example. We know that platelets were, in some patients, were down due to COVID, but not everyone. Dengue, we know that it affects only the platelets. So indirectly, one can see in COVID patients an anemia or a drop in hemoglobin, but not directly causing low hemoglobin.
Yeah, thank you very much, Doctor. I think it was a very insightful and very, very informative session.
Thank you.
I hope all the questions of the citizens here today who participated with us has answered. We'll have many more, maybe, Doctor, with you. And it was really a beautiful session, and also that you have answered all our queries. Thank you very much. You can write to Doctor, and I think Namita has shared her number. So you can touch base with Doctor at Millers Road, Manipal Hospital, the old Vikram Hospital, and touch base with Doctor for more. Thank you so much, Doctor.
Thank you. Thank you so much. Thanks everyone for participating and for your initiative of educating and doing social work for Nama Bengaluru, which is absolutely required. I love it. Thank you.
Thank you so much, Doctor. Thank you.
Bye.
Thank you, everybody. Bye.
Bye.